My girlfriend, she fell and her head went straight through the wall.
She tripped and her head went through a wall.
Yeah, straight through it. It's crazy.
Sky-high hookups, the dangers of gummies, and mysterious blue body fluids. Today, we're breaking down and reacting to all the risky business, type injuries, and wild medical scenes from Sex Sent Me to the ER. All right, let's dive right in.
I want that yummy gummy.
I cut a hunk of his head off and I throw it in the microwave.
Okay. I think putting it in the microwave, I think it's gonna like liquefy. Let's see what happens.
I know, baby.
No, it's really hot. It's super hot.
You're super hot.
No, it's not a good hot, Michael.
No, I'm really hot. Like I'm getting first, second degree burns on my chest. Get this stuff off.
Just get it off of me.
I'll lick it off.
Get it off.
My tongue.
What?
It pierces your chest.
My what?
It was skin from my chest.
What? I'm assuming he's speaking that way because he has burns to the tongue, maybe a little bit of inflammation, and it hurts, so he doesn't want to have full movement of his tongue.
Josie, right? I'm Janet. I'm an ER nurse. I understand that you have a burn. Let me take a look.
Oh, damn.
Almost impossible to get off the skin because it continues to burn.
Most common burns that I see in the emergency department are related to cooking and hot water or hot soups. You need to get whatever is causing the heating or the burn off the skin ASAP. You're having a very hot food item that is then starting to solidify, but it's still producing heat. And so you have to get that off the skin. And what the doctor is saying here is because of the sugary content, the stickiness of it, it's harder to get off of the skin. And again, it continues to heat up.
I'm not wearing any panties.
Oh.
When we jump, I want you to make love to me midair.
Whoa! I mean, I feel like that's dangerous.
I was already hot as it was. I mean, felt like my blood pressure was high as sky.
1 minute, jump run!
So yes, blood pressure being elevated, typically relating to like adrenaline release, anxiety, that is quite normal. Our blood pressure does fluctuate throughout the day. It's not stagnant at the exact same blood pressure.
My arm had been thrown into my face. Never been hit like this. I'm trying to get my leg straight and I can't. From belly button to kneecap, that old side is in trouble.
So belly button to leg, probably related to those cords. As he came up, smacked his own face in the nose, he potentially broke his own nose. If the nose is straight, we typically won't try to reset it because it's straight. If it's a little crooked, sometimes it's really hard to tell if there's a lot of swelling. So if you want an image of the face, typically a CT scan of the face is important.
Hey, we need a doctor right away.
You getting a bar fight or something?
No, he fell out of a plane and he's hurting bad.
To the use of tampons, they're super absorbent, which is great. We actually use similar devices for nosebleeds. It's called a rhino rocket, and we actually have air that we can put in there. So they slide right in, and it allows you to put air in to be able to push it against the walls of the nose to fill the cavity as well as get the bleeding to stop.
When I ejaculated, it was blue.
The detective work has now begun.
I've had patients come into the emergency department where they say they have blood in their semen, and this does happen, but blue in the semen, interesting. I wonder if there's something that person ingested or drank.
It's possible it got mixed with the paint, but there are a few STDs that could cause discomfort.
You didn't tell me you had an STD.
It doesn't matter, we used a condom. I mean, I don't have an STD.
Typically, the STDs that we check for in the emergency department are the common ones, basically gonorrhea and chlamydia. Chlamydia could be like a grayish blue-ish. Typically, gonorrhea looks more like a purulent kind of pus type color.
We'll have to do a routine STD check.
You know what to do.
I needed a urine sample.
Wow, a routine STD check is a urine sample, and he comes back with a sample of his ejaculate.
I just want to check for any damage to the scrotum or tailbone just in case. Blue semen can be caused by an infection of the prostate. As he was ejaculating, his semen came out blue, which usually indicates a very specific type of bacteria. It's called Pseudomonas.
So Pseudomonas can be like a bluish green type color, potentially because all the trauma that he had could seed an infection down in that area. Make sure you're not doing any excess trauma to these parts, and typically these will go away with certain specific antibiotics related to Pseudomonas.
We proceeded to have sex while I had my penis in the door.
Please don't do that. You're gonna get swollen and stuck in the door or cause splinters, lacerations.
Babe, what's wrong?
I'm stuck. And it hurts.
What do you mean you're stuck?
Basically a penis ring so tight around your shaft of your penis, not allowing the appropriate blood flow to get out of your penis, and now it's starting to swell. Blood's going in, it can't get out.
What's happening?
Eric was just like in so much pain, visibly.
Maybe if we just finish what we started, it'll go back to its normal size.
I figure we can just finish having sex and maybe the swelling will go down.
Not a bad idea in the sense of maybe if the stimulation is gone, the blood flow will decrease and you can not have that erection anymore. But the problem of the mechanism is it's now stuck there and you can't get it out.
Okay, maybe we should wait till it shrinks on its own.
Too painful.
Might take a while.
I had to explain that that was going to take a while because I had taken a male enhancement pill in the morning and then again right before the fun times with the door.
Oh my gosh, it gets worse. So male enhancement pill like Cialis or like Viagra. Literally, I've had individuals come to the emergency department with prolonged erections due to these medications. And the concern is that that blood that's stuck in your penis starts to become tissue, starts to fibrose, and you will permanently have a dysfuncted erection.
Oh no.
What do you mean, oh no?
Ooh, it's turning purple and it's swelling up.
When I saw my boyfriend's penis turning purple, I was thinking he might just lose his penis.
And this is actually a thing. Sometimes you can actually lose your penis. It can necrose off and die, meaning that so much blood is there that it actually is not able to get anything out and you're not getting any oxygenated blood to that tissue, and so the tissue could die.
And we're going at it. So I'm trying to go as full out as I can, But what happened was her top of her head was pushed against the back wall. 440 pounds pushed her. Her head went through the sheetrock wall.
Oh, thank goodness it was between the studs where the sheetrock is attached, because if you smashed into where the stud is, you potentially will cause a massive worsening injury, at least the wall gave.
My girlfriend, she fell and her head went straight through the wall.
She tripped and her head went through a wall.
Yeah, straight through it. It's crazy.
So top of the head injury, you worry about compressive force fractures to your cervical spine and your neck, and then obviously any skull fractures or intracranial bleeding. It's good that they brought her to the hospital because she passed out. Trauma to your head can cause you to pass out. The word we use is called syncope. These are actually really good. This is something I deal with on a daily basis, and all these doctors and staff members probably did what they would normally do. Also, check out my new supplement company called Life Happens. And if you guys are interested in me doing more of these, please let me know in the comments. And as always, please make sure you check out this whole playlist right here. Binge watch everything. Turn on your notifications, hit that like button for me, and subscribe. Thank you so much for watching, and stay healthy, my friends.